Thank you. It's so lovely to see so many family, friends and colleagues here this afternoon, and also to have the opportunity to share the stage with Matt, and a huge thanks to Matt to let me go first. Mainly so my daughter's still awake as I'm talking. So I really enjoy going to other people's inaugurals because you always learn something new. I'm guessing that most people that know me in the room know that I'm from north of the border. I'm a little bit proud of being from Scotland. But most of you, yeah, thank you. But most of you probably have never heard of the wee town that I grew up until about 2 weeks ago, when unfortunately Brechin was at the epicentre of Storm Babette, and there was quite a lot of devastating damage to the town. And this was me in said Brechin. I'm that one in case you're interested. I was expecting a few awes, you know. I was probably about two and a half here, and this was about 6 months before I was diagnosed with cancer in both of my eyes, something that has shaped me as a person, but more importantly, shaped my career, and that's why I'm talking about it today. And this is me still in Brechin, this one here in case you don't know, around a time where I decided I wanted to be a paediatrician. For clarification, I really like my siblings, I just don't like getting my photograph taken. The neighbours' kids at the back obviously really like getting their photograph taken. So that's what I did. I went off to study medicine at the University of Aberdeen. I graduated in 1999. Remember being on call the night of the millennium and all these exciting things. Did my membership exams, got my specialist registrar training number, and then quite unexpectedly became seriously unwell. And there's somebody sitting in the front row without whose support and love and kindness I would not be standing here today. Professor Neva Heites and her husband Roy. Roy failed to make me a golfer, but he achieved keeping me here today, which is really important. There's a real added benefit though, because Neva was the vice principal of the University of Aberdeen, so I got a few snippets of what higher education looked like and worked, and made me realise that maybe that was an opportunity for me. I was lucky enough in my last 6 months in Aberdeen to have a taste of working in academia with Professor Peter Helms, who was Professor of Paediatrics at the time, and really unexpectedly enjoyed it, and decided that might be something that I wanted to do to further my career. So I made the quite difficult decision from somebody for the northeast of Scotland to move south of the border for a year in 2007. And I came to the University of Leeds. I had a particular interest at that point in chronic disease in children, but more around obesity, the obesogenic environment, rather than the chronic diseases that I now work with. And I met Professor Janet Cade and Professor Kim Edwards, and I undertook a Masters in Nutrition, Obesity and Health. I published my first paper, which unexpectedly showed that there was more fast food outlets in areas with high obesity levels, but obviously also in areas of high deprivation, which is a bit difficult to unpick and untangle. Janet and Kim persuaded me to apply for PhD funding, which was something I didn't think I would ever do, and they tried to persuade me that Yorkshire was an okay place. So somebody else made me realise that Yorkshire was an okay place to live in, and Andrew and I got married. So I applied for ESRC and MRC funding to do my PhD and was successful, and Janet and Kim brought in reinforcements in the form of Professor Graham Clark from the School of Geography at Leeds. And it was an unexpected turn for me, but a real opportunity to work in the School of Geography, where the kind of non-medical model of health and well-being was something that was really focused on. And so, certainly when I was a medical undergraduate 100 years ago, it wasn't something that we really talked or spoke about. So I really enjoyed that period doing my PhD, but I knew that this wasn't necessarily the topic area that was going to keep me getting up in the morning, and I really was struggling to see how much of a difference we could make. That said, if anybody needs any recommendations, I still have an intricate knowledge of where the fast food outlets in Leeds, Bradford and Bristol are. And around the time I started my PhD, there was a job advertised at the University of Leeds that was funded by Martin House, our local children's hospice. Now, Martin House became the second children's hospice in the UK and in the world when it opened in 1987. And at the time, they had a very forward-thinking chair of the Board of Trustees who was a paediatric oncologist. And he kept saying, I know how many children have cancer in Yorkshire and Humber. We have great registry data. Why can nobody tell me how many children may benefit from hospice or from palliative care input? And that was a challenge. So I applied for the job. I met 4, again, very special colleagues. So we have Patricia McKinney on the top left, who's Professor of Paediatric Epidemiology, Dr. Roger Parslow, both from the University of Leeds, and Jan Aldridge, a clinical psychologist from Martin House, and Mike Miller, who some of you in the audience will remember as a consultant from Martin House. And we started that piece of work, but very soon realised there was such a gap in understanding, in evidence on which to care for children who were really seriously unwell and unfortunately dying. We didn't have a good evidence base for that, and maybe there was an opportunity here to grow that evidence and to make what is a difficult time better for children and families. So I got my very first research grant from what was Children's Hospice UK at the time for I think about £20,000, and what we did was exactly what the chair of the Board of Trustees had asked, and we used data that we collect all the time in our NHS to try and estimate how many children and young people may have a life-limiting condition that would benefit from palliative care input. And we showed at that time there was 3 times as many children as we thought previously. This is the paper I'm probably most known for and has been the building block of other work that I have done, but I do other things as well, because I only do data. And it was a building block for some work that we did for the Scottish Government a few years ago, which resulted in children and young people being mentioned in their palliative care strategy for the first time, and a significant investment into paediatric palliative care services in Scotland. I'm just part of a group at the moment where we're revising that strategy, and we're getting even more recommendations about children and young people there. And also, just a bit more recently, some work we've done again for the Welsh Government to help inform their strategy development, and showing that although it's still relatively rare, these children and young people are very high users of healthcare. They account for 7 in 10 intensive care beds at any time. I'm sure we all have years in our life that are memorable for good reasons and for bad. 2012 was, I think, quite a special year for me. You might recognise the outfit. So I graduated and finished my PhD. I got my first proper academic post as an anniversary research lecturer at the University of York. For those of you who don't know the University of York, we're very proud of our wild fowl. And this is a very special duck called Longboy, who unfortunately we think died in the summer. And a fox may have had him, but he was a hybrid between a mallard and an Indian runner duck. So he is really tall. And also my greatest achievement was this young lady in the front here, who's slightly less yellow these days. Although you were looking for a yellow jumper earlier, so you could have made that joke a bit better for me, Elspeth, if you'd found it. And when I came back from maternity leave, again working still with my colleagues at the University of Leeds, we put quite an ambitious proposal to the Board of Trustees at Martin House for funding for a research centre. Now, whilst I think we're not bad at writing research proposals, I think it was still a bit of a risk and a bit of a gamble for them. And they funded us and they supported us. And I'm exceptionally pleased that they did, because I think the centre produced some really important work that has influenced the care of children and families. I feel quite uncomfortable standing up here talking about me and as though I do all of these things, when medical and health research is very much a team sport, and working in partnership with people is really important. And working with parents and young people themselves is one of the most satisfying parts of my role. And we really enjoy doing it. Richard's already spoilt this and told you that we got the Royal College of Paediatrics and Child Health Prize in a couple of years ago. But I think the last sentence there is really important, as we want all of our work to be driven by the needs of parents and children. As an academic, I can stand here and talk about really interesting research questions, but that's not the purpose of what we're trying to do. Also, my clinical colleagues, you'll notice there's no names or photographs here. Firstly, it's difficult to get photographs of clinicians, but also I didn't want to forget somebody and upset them. But paediatric palliative care is a really small speciality, and after an initial period of suspicion, I would say I've been welcomed into the fold by the clinicians, who all work really. They all take time out of their main jobs to work with us and help support our research studies, and that's really, really important. And as well, from Together for Short Lives and all the hospices, and I'm very, very grateful to them. Apologies to anybody that's heard me speak before, but I also get a little bit cross that we think we're very special and we have to reinvent everything in paediatric palliative care, and actually we should work more with other specialities. And I have fantastic colleagues in paediatric oncology, neurology, paediatric intensive care, neonates, that again all contribute to our work and make this successful. PhD students are quite fun, aren't they? It's a great opportunity to work with people who are usually smarter than yourselves, and also the next generation of students, and there's a mixture of clinicians and researchers here and practitioners. I'm just going to, Stuart is the only person I know who came into the second PhD though, which seems slightly unnecessary. Funders are really important to the work that we do, and we've got some funders in the audience today. And we're very grateful for funding the research that we do, because we have an opportunity to change and improve care for children. But in terms of career development and progression as an academic, I think I need to highlight the NIHR Academy. I've been really fortunate to have both a postdoctoral and career development fellowship, so about 8 or 9 years worth of funding from the NIHR fellowship programme. It ends in December. I'm having anticipatory grief already that it's not there, but I think it's such a golden ticket and opportunity to really develop your skills, both methodological and leadership. So the Martin House Research Centre, I think, was quite successful. I have a huge team that worked with me, all very dedicated. We completed 28 studies in the 6 years, published about 70 papers, and however much grant income. But more importantly, our work influenced the care and the policy and practice for children with very complex and life-limiting conditions. I worked with a very large number of fantastic colleagues at the University of York, but there are 3 who stand out particularly in terms of their, both individually and collectively, the support that they provided to me during that time. And Professor Trevor Sheldon, who some of you may know is now at Queen Mary, Professor Kate Pickett, who you may know of the Spirit Level fame, and Professor Catherine Hewitt, who's the co-director of the Trials Unit. And together they supported my fellowship applications, they supported highs and lows at the University of York, sometimes told me to behave, particularly Trevor. But also really importantly helped me with the really tough decision to decide to come to King's, because things were going well at York, and it wasn't an easy decision for me, but they all supported me in making that decision. This is the best emoji when you Google female professor. So in early 2020, I was awarded my personal chair at the University of York, and whilst I was very pleased, it didn't really quite stop my itchy feet as I thought it might. I thought being a professor was the end, and it was great, but it doesn't work quite like that. And then COVID arrived, and I'm sure everybody in this room has suffered the negative consequences of COVID within their family or close circle of friends. And I'm no different, but I would also say that COVID was probably an opportunity for me in my career. I battled a little bit with being a clinically qualified person that could potentially be helpful in the pandemic, and realised I might be able to get a yellow cannula in a 500-gram neonate, but I'm not sure how useful that would be in an ICU full of 120-gram older adults. And a very sensible academic from Oxford said to me, "Do what you do best." So that's what I tried to do. But again, 2 very important individuals who helped me do that. The first is here, so I can put her picture up, is Professor Fliss Murtagh, who some of you know, and is currently Professor of Palliative Care at the Hull York Medical School. And Fliss has supported all of my work at the Martin House Centre. And the most useful thing I felt I could do at the pandemic was say, can I support some of your research while you do real work, Fliss? And she said yes, and I said, of course, I want a favour in return, please. What's going on nationally about palliative care, and can you get me involved? So that is when Fliss asked Professor Irene Higginson, who, if you don't know in the room, is the giant of palliative care research across the world, except for children. And I don't know how much arm twisting or persuading was required, but I was welcomed into the Cove Pal team, which was my first opportunity to work with grown-up academics, and to work more closely with Irene, Catherine, Sleeman, Sabrina, and others from CSI and also from other institutions. And I'd have to say it was a really enlightening experience watching Irene's leadership. I can't remember how many papers we published from this and the impact on policy, but it was really important and really highlighted the need for palliative care during the epidemic. And I think maybe started planting seeds in people's minds about where I might want to work later. I don't know. And the second person I want to mention is Dr. Hilary Cass. Many of you will know her previously as a consultant paediatrician at the Evelina, a previous president of the Royal College of Paediatrics and Child Health, previous chair of the Board of Trustees of Together for Short Lives. And again, around about 6 months into the pandemic, Hilary recommended me to a group from the Royal College of Paediatrics and Child Health and the National Clinical Director for NHS England, who were trying to work out which children and young people might be seriously ill from COVID. And if you remember 10 minutes ago when I was talking about my first research grant, that was the methodology that underpinned the work that we went on to do. And we published a series of 3 papers, which in itself was fine, but what was more interesting was the opportunity to present to the Joint Committee on Vaccine and Immunisation, have our work influence the Chief Medical Officers and be able to highlight the importance of vaccinating children with very complex neurodisability, because we know, thankfully, most children are at very low risk of serious illness from COVID, but not all of them. And we don't believe in metrics, but I don't think I'll get a better altometrics than that any time soon. And then King's College suddenly appeared. I've mentioned Professor Higginson already, but the second person in the picture there you've already heard from, Professor Richard Harding. And I'd had an opportunity to work with Richard for a short period of time on his outcome scale work, but for a much longer period of time had admired the fantastic and revolutionary work that he's done in palliative care in Africa, and was so pleased that he is interested in children and young people. So I don't want to say a double-pronged attack because that sounds really negative, but seeds were being planted about if there was an opportunity at King's, would I be interested? And at that point, I didn't think I was, I'm going to be honest. It was in London and it was noisy and busy. But also, more importantly, I'm talking a lot about palliative care today, but my portfolio is not only palliative care, and I do more broader child health things. And I remember having a discussion with Hilary Cass, and I've got the answer to this. Let me introduce you. And she duly introduced me to Professor Ingrid Wolf, who again is somebody who I admired her work from afar, but had not had the opportunity. Our paths had not crossed previously. And it all sort of clicked into place. Obviously, there was an interview process and all that, and all those things. But a year ago today, I started my perfect job. Well, almost. So we have King's campuses across London. We have King's at Denmark Hill. We have King's at the Strand. We have King's at Waterloo. King's at Guy's. I think King's at the Highlands has to be our next. Our next campus. We could have views like that every day. That's not a random photograph. Robin House Children's Hospice is just here on the edge of Loch Lomond. I'll work on that one maybe with Irene later. The other reason I was really keen to come to King's was the new opportunities. Every time I saw, usually Julia Downing, presenting this infographic around the fact that 98% of children who needed palliative care lived in low and middle income countries, it did make me wonder what was I doing only focusing in the UK, much as there is a great need here. And working, again, the advantage of working with Richard, I've had the opportunity to visit Africa twice this year and to see a scale of suffering and need that I thought I understood child health, but I had no idea. And it was very, very difficult to see and very, very difficult to watch, but also a real opportunity to see where we can make a difference. I need to be better at avoiding viruses in Uganda, as I'm still ill 2 months later. But working closely with parents and children and healthcare professionals was really an excellent experience, and I think I'll go back, Richard. So I'm really excited about my future here at King's. I'm working with colleagues at King's and King's Health Partners. Apologies if your photo's not there, it's just I couldn't find it. But I think together we have a real opportunity to make a difference to the lives of children and families who have really serious health issues. I can't do this myself, and I'm very lucky to have an exceptionally supportive family and friends. I know you're not supposed to have favourites, but these guys are always really happy to see me. Bramble not anymore because he's not here, but Freddie and Rom, who many of you will have seen in the back of Teams meetings on my sofa. But seriously, my exceptionally supportive and tremendously tolerant husband and little girl are so supportive of the work that I do, and me not being around all of the time. But that means Elspeth gets to eat more chicken pies with her dad, so that's all right. But also my brothers and sisters, nieces and nephews. My sister does a bit for fertility, and my little brother does a lot of public health messaging if you're interested. But that's my story, and thank you.